Assalamu alaikum. My name is Mariam Rafiq. I am student of second year OshIMU and I am representing Group B, the trauma trooper groups. And our topic of presentation is tobacco and alcohol. First of all, tobacco. Tobacco is a common name for several species of plants, and almost 70 species of plants are known, out of which most important is Nicotiana tabacum. And most common exogenous cause of cancer is tobacco, out of which 90% are lung cancer. And when we talk about oral cancer, then smokers are at 10 times higher risk of having oral cancer than non-smokers. And causes include the cigarette smoking and smokeless tobacco. Smokeless tobacco includes snuff and chewing tobacco, and then more than 60% of oral cancers are because of smoking. And then lung cancer, number one cause of lung cancer is cigarette smoking, and it includes the causes of active smoking and passive smokers. The passive smokers are also second-hand smokers. These are those persons that are exposed to tobacco present in the environment. And then statistics, out of 100%, 2/3 of smoking is done in 10 countries. At number one is China. China is the number one producer and consumer of tobacco, and then India, then Indonesia, Russia, and United States of America, in which almost 400,000 deaths per year occur because of smoking. And it is well said that you are not just burning a cigarette, you are burning your life. Like this. Thank you.
Assalamu alaikum. Today my topic is carcinogens and risk rate. Smoke of cigarette contain 2000 to 4000 substances, out of which are 60 carcinogenic. A few of them tar, polyacyclic aromatic hydrocarbon, and benzopyrene and nitrosamine. Phenol is another substance which is present in cigarette smoke, causes irritation of mucosal lining of tracheobronchial tree, which ends up in inflammation of mucosa and increase mucus production. Carbon monoxide present in cigarette smoke impairs transport and utilization of oxygen. Formaldehyde and nitric oxide causes mucosal irritation and toxicity to cilia. Nicotine stimulates ganglion, leads to depression and tumor promotion. Nicotine stimulates acetylcholine receptor in brain. Then synthetic neuron increase secretion of catecholamine, which causes increase in heart rate, increase in blood pressure, increase in contractility of heart, and increase in cardiac output as well. So 75% of smoker lives 70 years of age. Risks depend on number of cigarette packets per day multiplied by number of years. Thank you.
Today's my topic is smoking. Smoking causes lung cancer. Smoking agents mucosal irritation of tracheobronchial tree that end up with inflammation with increased mucosal production. Due to inflammation, it is called bronchitis, acute bronchitis. Smoking agents can lead to requirement of loquitis in lungs tissue that increase the acetate activity, and due to this activity, these are damage of lungs tissue and cause a disease called as emphysema. Also cause chronic bronchitis, COPD, chronic obstructive pulmonary disease. Smoking other disease. Smoking cause cancer, esophageal cancer, peptic ulcer, pancreas, kidney, cervix, bone marrow, blood cells, and leukemia. That's it.
Assalamualaikum. I am going to explain the adverse effect of tobacco on heart. As we know that the tobacco can leads to the myocardial infarction. It leads to the myocardial infarction or the necrosis of the heart tissue because of the smoking agents leads to the increased platelet aggregation and atherosclerosis. As the platelet aggregation will be increased, so there will be occlusion or the blockage of the blood vessel, which causes the decreased oxygen supply and necrosis of the heart muscle, which is called as myocardial infarction. The second reason is the atherosclerosis, which leads to the myocardial infarction. Atherosclerosis is the hardening and narrowing of the blood vessel. As we know that there is the fibrofatty plaque or atheroma will form in the blood vessel, which leads to the decreased oxygen supply and necrosis or death of the heart muscles or tissues, which is called as myocardial infarction. It causes the decreased oxygen supply to the heart muscles or other tissues and increased oxygen demand. Increased oxygen demand is because of two reasons: carbon monoxide and lung disease. As we know that the smoking agents includes also as carbon monoxide, which impairs the oxygen transport as well as utilization of oxygen. And there are also lung disease, which is caused by the smoking agents. The lung disease includes the emphysema and the chronic bronchitis, which causes decreased perfusion of the oxygen. So there will be decreased oxygen supply to the heart or to the blood, and decreased oxygen supply as well to the heart. It also causes decreased threshold of the ventricular fibrillation. Ventricular fibrillation is the 200 to 300 beats per minute pumping of the ventricles or heart, which without pumping any blood to the other organs. As it will decrease the threshold of ventricular fibrillation, so there will be easy access to the ventricular fibrillation. It also causes the hypertension, which is the high blood pressure, and hypercholesteremia, which is the increased cholesterol level in the blood. As we know that the cholesterol level, increased cholesterol level causes the heart or coronary diseases. Thank you.
Bismillahirrahmanirrahim. My name is Hafiz Mirza, and I am student of 3rd SEM of OshIMU, Osh International Medical University. Today I am going to tell you about the effect of smoking in pregnant female. It is a topic of pathology. We know that smoking is not a good thing for our generation, for young, for old, for people, for men, women. But now I am going to tell you about the effect of smoking in pregnant female. First one is in pregnant female, there is difficult to pregnant, mean there is no pregnancy occur in the female. Second one, it causes damage of tissues in the unborn baby. It means that in the unborn baby, the tissue are not a normal. Abnormality may be faced in the tissues of unborn baby. And the third one is damage to lung and brain. Damage to lung and brain of newborn baby, maybe brain not fully developed or lung affected in the baby. And fourth one is spontaneous abortion before less than 20 weeks. It means that in the pregnant female who used to smoke, it faces the abortion before less than 20 weeks. It is very bad, And next one is preterm birth before 37 weeks. It also due to smoking in the pregnant female. And the next one is stillbirth or dead baby. It means that due to effect of this bad thing, the born baby may be dead or not fully developed. And the next one is intrauterine growth retardation. A newborn baby maybe faces the growth retardation or many other problems. And next one, in the first trimester, we know that this trimester, in the first trimester faces the problem. Other one is it is irreversible. Now I am going to tell you about the causes of smoking in pregnant female. In the newborn baby, first one is cleft lip, cleft palate, and also cancer. No, these all are the effects of smoking in female. Female avoid smoke during the pregnancy. Thank you.
My name is Sharaf Ibar. I am the student of second year at International Medical University. Today my topic is alcohol. Alcohol is more hazard and claims of more consumption than heroin and cocaine. Moderate alcohol ethanol increase survivals in heavy drinkers and teetotalers. And 20 to 30 gram of alcohol per day or 20 to 50 ml of wine is a reason cause of increase in HDL, decrease in fibrosis, decrease in coronary heart disease, and decrease in platelet aggregation. Statistics of alcohol in Western countries, 50% people drink alcohols, in which about 5 to 10 are chronic alcoholics. In 10 million of alcoholics people, about 1.8 million deaths per year, and 50% of deaths are due to drunk drivers, homicides, liver chronics, and suicides.
Assalamualaikum. Today I am going to explain the mechanism of action of alcohol. Alcohol intake will lead to the absorption of unaltered ethanol in stomach and small intestine. It is distributed equally in body fluids and blood. Out of this, the 10% is excreted unchanged in sweat, urine, and breath test. Breath test is done by a law enforcement agency. Next, there are two enzymes in liver. That three enzymes will convert ethanol to acetaldehyde. First is alcohol dehydrogenase, which is present in the cytosol or cytochrome of the hepatocytes. Cytochrome P450 system. There will be a conversion of ethanol to acetaldehyde that will lead to the metabolic acidosis. Metabolic acidosis is increased acid and less pH, which will lead to the multiple fat droplets in the hepatocytes. And the reason of the acidosis include the increased production of acid, increased reabsorption of acid from the kidney, and increased excretion of bicarbonates. Next enzyme is microsomal ethanol oxidizing system, which is active when there is an increased amount of alcohol in blood. Next enzyme is catalase. It uses substrate hydrogen peroxidase. When it is active, there is 5% or less than 5% alcohol in blood. There is 5% or less than 5% alcohol in blood. There will be a conversion of acetaldehyde to acetate in mitochondria, which is utilized in respiratory chain. Next, there are the drunk drivers, which have 80 gram per deciliter of alcohol in blood. 200 gram per deciliter of alcohol in blood will lead to drowsiness, and 300 gram per deciliter of blood will lead to stupor, which is a state of unconsciousness, and greater than 300 gram per deciliter will lead to respiratory arrest, and 700 gram per deciliter of alcohol in blood are chronic alcoholics.
Assalamu alaikum. My name is Mohammad Abdulwase. I am second year student of Osh International Medical University, Kyrgyzstan. Today my topic of presentation is adverse effects of acute alcoholism. Acute alcoholism affects three organs: central nervous system, stomach, and liver. Now we go to central nervous system. When the acute alcoholic effect on central nervous system are depression, subcortically damage. For example, diencephalon plus basal ganglia. It also impaired cortical area or nephrons, impaired water system or lingual activity or agility. When alcohol in the blood increases, level of alcohol in the blood increases, that impaired cortical nephrons or lower medullary center that cause respiratory arrest. Now we go to stomach. Use of alcohol damages stomach in two ways: acute gastritis or ulceration. Ulceration means burning in the stomach, etc. Now we go to liver. The acute acute alcoholic effects on the liver are multiple, for example, multiple drugs which are present in the liver or accumulate in the liver that cause fat in the liver called hepatic acidosis. The acute alcoholic or irreversible rashes which can be reversed. Thank you.
Assalamu alaikum. My name is Shahroz Tariq. I'm a student of OshIMU. Today our topic is effect of chronic alcoholization. The use of alcohol is very harmful for human beings. The damage caused by use of alcohol are non-reversible. It shortens our lifespan. Most common site in our body which is damaged by use of alcohol is liver. It may cause many diseases such as alcoholic hepatitis, liver cirrhosis, and portal hypertension. In this, there is an increase of the chance of hepatocellular carcinoma. Alcohol affects other organs such as in digestive system, in GIT, bleeding from GIT. It causes bleeding from GIT, which causes gastric ulcer. Use of alcohol also causes deficiency of thiamine, which leads to Wernicke-Korsakoff syndrome. Use of alcohol also affect our cardiovascular system, which causes alcoholic cardiomyopathy. The use of alcohol also causes the malnutrition, such as vitamin deficiency, etc. Alcohol has free calories. 1 gram of alcohol contains 7 calories, but these calories are not essential for our body. All these are chronic alcoholization, and this is not reversible, and a person may die after excess use of alcohol. Thank you.
My name is Ahmed Aburok, my teacher Dr. Muhammad Isa. Today we discussed about effect of alcohol including pregnancy female and acute pancreatitis and alcohol and cancer of alcohol. Alcohol abuse causes in pregnant female. Most common causes acute pancreatitis in pregnancy are caused by gallstone disease. It is taught with weight and hormonal change induced by pregnancy in female. And first one, terminal fetal alcohol syndrome, and it is irreversible. And causes of alcohol in fetus, microcephalia and facial abnormality, and third one, growth alliteration. And causes of cancer. Alcohol causes of the cancer. Example, first one, breast cancer in female and oral cancer in female and in male. No. And alcohol causes acute and chronic pancreatitis. And also causes of cancer, increased fat level in blood, and also increased oxygen level distribution, and certain meditation trauma. And the last one of causes of cancer,